Welcome to Rwanda Medical Academy. Today's lesson is about the primary causes of subarachnoid hemorrhage. We will use a helpful mnemonic BATS to make it simple. Now, ever wondered what causes a subarachnoid hemorrhage? To understand this, let's first unpack what it actually is. A subarachnoid hemorrhage, or SAH, is a medical emergency involving bleeding into the subarachnoid space. This is the area nestled between the arachnoid membrane and the pia mater, which are layers surrounding the brain. The bleeding here can stem from various causes, creating a potentially life-threatening situation. And to simplify the complex world of these causes, Rwanda Medical Academy brought a helpful mnemonic known as BATS. And each letter stands for a primary cause of SAH: berry aneurysm, arteriovenous malformation, trauma, and stroke. These conditions, while diverse in nature, all can lead to a common outcome if not promptly addressed: a subarachnoid hemorrhage. Today we delve into the BATS mnemonic to understand the primary causes of this life-threatening condition, starting with B. Berry aneurysms are a leading cause of non-traumatic subarachnoid hemorrhage. These small berry-shaped outpouchings are more than just a peculiar anomaly. They are a potential ticking time bomb that can lead to a serious medical emergency known as a subarachnoid hemorrhage, or SAH. Berry aneurysms, also referred to as saccular aneurysms, are tiny bulges that form in weakened areas of cerebral arteries, often at arterial bifurcations where the artery divides or splits. Think of it like a small pouch or a sac forming on the side of a river where the water's current is the strongest. But what makes these seemingly innocuous berry aneurysms so dangerous? The answer lies in their propensity to rupture. When a berry aneurysm bursts, it results in sudden and severe bleeding into the subarachnoid space, the area between the arachnoid membrane and the pia mater surrounding the brain. This abrupt and intense bleeding is what we call a subarachnoid hemorrhage. The significance of berry aneurysms in the context of SAH cannot be overstated. They are one of the most common causes of non-traumatic SAH, meaning those not caused by physical injury or trauma. Certain factors may make an individual more susceptible to developing berry aneurysms, including a history of hypertension, smoking, and even genetic predisposition. Therefore, understanding berry aneurysms is crucial in the study and diagnosis of subarachnoid hemorrhage. Recognizing the risk factors, the potential for rupture, and the ensuing complications can aid in the timely detection and treatment of this life-threatening condition. So when you think of berry aneurysms, don't just see them as small, berry-shaped outpouchings on cerebral arteries. See them as potential triggers for a medical emergency that can have severe, even fatal consequences. Remember, berry aneurysms are small, but their impact can be life-threatening. R stands for two potential causes: arteriovenous malformation and adult polycystic kidney disease. Let's first explore arteriovenous malformation, commonly abbreviated as AVM. This is an intricate tangle of blood vessels where arteries shunt blood directly into veins, bypassing the usual capillary network. This abnormality can be quite dangerous, as a rupture within this network could lead to severe bleeding into the subarachnoid space, subsequently causing a subarachnoid hemorrhage. Although AVMs are less common than berry aneurysms, they represent a significant cause of non-traumatic subarachnoid hemorrhage, particularly among younger individuals. Now let's shift our attention to adult polycystic kidney disease. This is a genetic disorder characterized by the development of numerous cysts in the kidneys and other organs. You might be wondering, how does a kidney disease relate to a brain condition? Well, this disease can actually lead to the formation of intracranial aneurysms. If one of these aneurysms ruptures, it can result in a subarachnoid hemorrhage, just like with AVMs. In both instances, arteriovenous malformations and adult polycystic kidney disease, the underlying mechanism is the same. An abnormal or weakened blood vessel ruptures, leading to bleeding into the subarachnoid space, and thus causing a subarachnoid hemorrhage. Although these causes are less common than baryaneurysms, it's crucial to remember that they pose a significant risk, especially since they can occur in younger individuals and those with a genetic predisposition. Understanding these causes and their potential to lead to subarachnoid hemorrhage is critical in the medical field. It allows for quicker recognition of symptoms, faster diagnosis, and subsequently more immediate and effective treatment. Though less common than baryaneurysms, AVM and adult polycystic kidney disease are key considerations in diagnosing SAH. Remember, in the face of a medical emergency, every second counts, and knowledge can mean the difference between life and death. Trauma, especially to the head, is a significant cause of subarachnoid hemorrhage. Now, when we talk about trauma, we're not just referring to minor bumps or bruises. We're talking about serious, impactful blows to the head that can result in a medical emergency. Imagine, for instance, being struck with a baseball bat. This kind of forceful impact can rupture the delicate blood vessels in the brain, causing bleeding into the subarachnoid space. This is what we refer to as a traumatic subarachnoid hemorrhage, or traumatic SAH for short. Traumatic SAH differs from other causes of subarachnoid hemorrhage in that it often doesn't happen in isolation. Because the kind of trauma that can cause this condition is usually severe, it's common for other injuries to be present as well. These might include fractures, contusions, or even additional types of brain injury. This is one of the reasons why immediate medical attention is so crucial in cases of traumatic SAH. Not only do these patients require treatment for the hemorrhage itself, but they may also need care for other concurrent injuries. Additionally, because the impact that causes traumatic SAH is often significant, this condition is frequently associated with a loss of consciousness. This can make it difficult for the patient to communicate about their symptoms or medical history, which is why it's so important for medical professionals to be aware of the signs and symptoms of this condition. In terms of symptoms, traumatic SAH often presents similarly to other causes of subarachnoid hemorrhage. Patients may experience a sudden, severe headache, often described as the worst headache of their life. They may also have nausea, vomiting, and neurological deficits, such as confusion or loss of consciousness. Understanding the role of trauma in causing subarachnoid hemorrhage is key to providing effective care. By recognizing the signs of this condition and responding appropriately, health professionals can help to improve patient outcomes and potentially save lives. Traumatic SAH often accompanies other injuries and demands immediate medical attention. And that wraps up our exploration of the T in bats. But stay tuned, because up next, we'll be diving into the final letter of our mnemonic. S for stroke. Strokes aren't just about blood supply interruption. They can also cause subarachnoid hemorrhage. Let's delve into the S in our bat's mnemonic, stroke. Stroke is a condition that occurs when the blood supply to part of your brain is interrupted or reduced. This deprives your brain cells of oxygen and nutrients, which can lead to their death within minutes. But did you know that strokes can also lead to subarachnoid hemorrhage? There are two main types of stroke. Ischemic, which is due to lack of blood flow, and hemorrhagic, a result of bleeding. While ischemic strokes are more common, it's the hemorrhagic strokes that we are focusing on here. Intracerebral hemorrhage, a type of hemorrhagic stroke, is characterized by bleeding directly into the brain tissue. This bleeding can extend into the subarachnoid space, causing a subarachnoid hemorrhage. So how does this happen? Well, if a blood vessel within the brain leaks or bursts, which is often due to uncontrolled high blood pressure or aneurysm, this leads to a hemorrhagic stroke. If the bleeding occurs in the area between the brain and the thin tissues covering it, this is known as a subarachnoid hemorrhage. Now, why is this significant? Stroke-related subarachnoid hemorrhage is a serious medical condition that requires immediate attention. The rapid buildup of blood can put pressure on your brain and result in life-threatening complications. Symptoms can include a sudden, severe headache, often described as the worst headache of one's life, along with nausea, vomiting, or a sudden loss of consciousness. It's critical to remember that time is of the essence when dealing with stroke-related subarachnoid hemorrhage. Rapid diagnosis and treatment can significantly improve the chances of recovery and reduce the risk of long-term neurological damage. In conclusion, strokes aren't just about the interruption of blood supply. They can also lead to subarachnoid hemorrhage, a life-threatening condition that requires immediate medical attention. Stroke-related SAH requires immediate assessment to prevent further neurological damage. Subarachnoid hemorrhage is a medical emergency that requires prompt diagnosis and treatment. The Mnemonic BATS brings together the primary causes of this condition: berry aneurysm, arteriovenous malformation, trauma, and stroke, with berry aneurysms being one of the most common causes of non-traumatic SAH. Arteriovenous malformations significantly contributing, especially in younger individuals, and trauma and strokes requiring immediate attention to prevent further neurological damage. These causes, when understood, can lead to timely recognition and management of SAH, potentially saving lives. Clinically, SAH presents with a severe headache, often described as the worst one's ever had, accompanied by nausea, vomiting, and neurological deficits. Prompt diagnosis through imaging studies, such as CT scans and cerebral angiography, is essential for identifying the underlying cause and initiating appropriate treatment. Remember BATS, berry aneurysm, arteriovenous malformation, trauma, and stroke, the primary causes of subarachnoid hemorrhage. Thank you for learning. At Rwanda Medical Academy, knowledge is power and value.